Thank you, and good morning or good afternoon, wherever the distinguished participants are. I am honored to be invited and have the opportunity to speak to you. Today is a special day for over 1 billion Muslims around the world, as it is the first day of the holy month of Ramadan, a month of fasting. So Ramadan Kareem to all of them. Yet this Ramadan is different from many others in our lifetime. In my country, Libya, before I say that, I could see that the other speakers are of a more advanced countries, and then I'll have a comment on that later. In my country, Libya, like all countries around the world, there is concern about COVID-19, a country of 6 billion people. It has gone through a lot of turmoil over the past 9 years since the former regime was overthrown. Turmoil that has broken into fights, civil war, death and destruction, and hundreds of thousands of displaced people, decaying infrastructure and poorly equipped medical system. So when this pandemic started, I could share that the whole people were so extremely terrified to see that even Europe and the United States and other countries and Asia and so on, who are very well advanced in medicine and in every way actually. Yet, despite all these incidents that Libya faced, the virus infections remain very low compared to even neighboring countries. To date, we have less than 70 cases have been registered in Libya. Not completely clear how did this happen. Since the outbreak of COVID-19, the government took a bold step to close Libyan borders to all travel. Airports were shut down and no one was allowed in with very few exceptions for most land borders. We still have the southern border, it's kind of hard to control. This situation is 6 weeks old and continues today. This action, of course, has, I'm sorry, my throat because I couldn't drink water, it's okay. The problem, we have more than we have 2 governments in Libya. So each government is doing their best in providing for the people. We have a problem of how the people are taking this or participating in it. Curfew has been forced in most of Libya, but curfew goes certain hours. Mainly now it's from 6 in the evening to 6 in the morning. So during the day, people are free to go out and shop and so on. Most of the people are not really applying what it needs, and what the situation needs to keep healthy or safe, even though information is provided. Hospitals are prepared as much as we can in Libya. There is lack of equipment, there is lack of medication. Lately, we had some arrived from as support from other countries. The action, of course, has left many Libyans who were traveling abroad, left them stranded. My husband and I are among them, since we happened to be in Istanbul at the time. So within days of the start of the pandemic, arrangements were made by Libyan embassies and consulates in several countries to house those stranded people, mostly in hotels. In Turkey, for example, 11 hotels were used to house some 2,000 Libyans who were in Turkey for business travel or medical treatment. Since the past week and continuing, most have been examined for COVID-19 infections, and those those found negative are housed in airport hotels for 14 days before arrangements are made to bring back to Libya in charter flights. Also, in the eastern part of Libya, efforts are in place to fully prepare a university building at the city of Brega, which is in the eastern part, to house those coming from Egypt and Jordan for the 2 weeks of quarantine following arrival to Libyan-Egyptian borders. Like you can see, we have several problems. As we have less infections within, we are trying to keep infections from coming from outside. So whether like in Turkey, they house them in hotels, or whether like in the eastern part, they're gonna take them from the borders of Libyan, Egyptian, and house them in universities. We had shipments arrive to Libya with masks, and people are making their own, what do you call it, disinfectants. But you know, it is still waiting to see where we're going to this. Up to now, we were blessed. We don't have a major disaster in the country, but I don't know what to expect, especially seeing what happened to Italy and to Spain and to Germany and to the United States and what have you. The fear is that the worst is coming. I wanted to add that my feeling, my personal feeling, that we owe it to this small virus, that for the first time in history, humanity has united rich and poor, governor and governed, politicians and people, families got to know each other, parents to know their children, pushed to reevaluate priorities in our lives, showed us how weak we are and how fake our powers are. We all hope and pray that a cure and vaccines are found quickly for this unprecedented epidemic, but we also hope that the lessons we learn, that we are one human family, that we should spend more on people's needs and welfare and less on weapons of war and destruction, more on opportunities for all rather than accumulation of extreme wealth for the very few, that we should value more those who serve humanity, such as doctors, nurses, social workers, teachers, community workers, rather than celebrities and so on. We hope that these lessons we are learning now are not soon to be forgotten. Thank you for your time and thank you for listening.